Hello and welcome to this short introduction on the Community Health Profile programme developed by the Public Health Department here at Birmingham City Council. In this video today I will cover an introduction into the evidence reports that are produced by Public Health, including the Community Health Profiles, the research and methodology for producing one of our Community Health Profiles, the available data and resources that we have produced to help support your work, and finally the engagement and next steps with these reports. The key priorities of public health is to look at bringing together information on the populations of Birmingham and the specific communities within the overall population. We're most interested in looking at investigating any differences in inequalities and health and wellbeing needs between different community groups. Some of these evidence reports we have to produce by law, and these are our statutory reports, which include our JSNAs, our Joint Strategic Needs Assessments, and our annual Director of Public Health report. The JSNAs are refreshed every year and are a snapshot of the health and wellbeing of the citizens of Birmingham and the factors that underpin this health and wellbeing. And it looks at inequalities on a high level. The annual DPH report looks at a specific topic or a focus area that the Director of Public Health has identified to investigate further as it may be a concern for health and wellbeing. We also then have a series of elective evidence reports which we choose to produce to further this understanding of our health and wellbeing needs within the different communities of Birmingham. These include our deep dive needs assessments, our topics-based commissions, and our community health profile reports. We're focusing on our community health profiles today, which are a desktop analysis of published evidence, grey literature, population survey data, and anything publicly available. And we use this to provide a snapshot of the overall health and wellbeing of a specific community of identity or experience. Public health priorities are guided by the health and wellbeing strategy titled Creating a Bolder, Healthier City for 2022 to 2030. And this outlines the main ambition, which is becoming a city in which every citizen can live a healthy and enjoyable life. And this strategy helped us formulate how we were going to present the key data that we identified in each community health profile. The profiles have several key objectives, mainly looking at helping us to understand the gaps or the health inequalities among different communities. Now we go a little bit further into that specific communities and looking at their individual health needs or inequalities of communities of identity, interest or experience. The profiles focus in a shift away from using terms such as BAME or LGBTQ+ to describe communities, as these often homogenise communities and overlook key differences in health and wellbeing. Therefore, our community health profiles instead will focus on the differences of experiences between our Nigerian and our Somali communities, for example, or our trans, our lesbian and our bisexual communities, and look at how the needs are going to be different. And most importantly, this profile programme looks at making sure that all of the data is in one convenient space so it's easy to access and easy to use to help guide decisions in public health practice. Now, these reports can also be used to help the council, its partners and community organisations to take action to actually help close the gaps and improve the health of the people in Birmingham. All of these resources are published on the council's website, and as we all know, the moment you put data down on paper and publish it, it's out of date. So there is a regular refresh programme where we aim to refresh each profile roughly every 5 to 8 years, depending on when new data is available. So for example, that timeline is shortened following on from the 2021 census release, where the existing profiles had to be updated as soon as possible. The overarching aims for what we're trying to achieve with the Community Health Profile programme are outlined in this slide. First and foremost, when we're talking about reviewing the health and wellbeing needs of a community, this means looking at the physical health, the mental health, the lifestyle, behavioural factors, and those wider determinants of health that exist in a specific community. As I said, those ideas are then collated and presented under the key areas that were identified in the health and wellbeing strategy, and these will be used as that key piece of evidence for local authorities and other organisations that work with healthcare and specific communities. We also don't want these to just sit on a shelf, so we want to promote the use of these summaries for wider system use and also for service development and implementation of new health and wellbeing services or approaches. Moving on to methodology and how we created the community health profiles. For the profiles that were published 2023 to 2024, they started with an Ovid search, which included search terms based on geography, community, making sure we had filters including the English language and only using journal articles from 2012 onwards to ensure that the data wasn't too outdated. We investigated a variety of databases including Medline, Embase, PsycInfo and Web of Science, and this functioned as the basic start point for our research in each of these community health profiles. There was some consideration for the data quality of these reports, so whether or not it was a systematic review or a case study report. However, for some communities, there was extremely limited information on health and wellbeing topics that were included in the profiles, and therefore we decided to include all of the types of data that was available. However, where the data is weaker or not available, we have put caution notices in the profile that they should be interpreted with a little bit more caution than something like a systematic review. We have refined this methodology over the years, so for the first round of published profiles that did not use this search strategy, they will be refined and updated with this search strategy in time. Now, just to provide an example of what that search strategy looks like in reality, you can see here on screen an example database search that was ran for Medline on the 12th of December 2022 for our Gypsy, Roma and Travellers community health profile that resulted in 288 resources. Although journal articles made up a large proportion of the data included in each one of these community health profiles, they certainly weren't the only type of data that was included. We also scoped for a breadth of government data sources, national health databases, and reports from relevant community organisations. Some of the main resources that we included are highlighted on screen and include things like the GP patient survey, fingertips data from OHID, the health survey for England from NHS, the 2021 census, and topic-specific sources. So, for example, when we were reporting on academic attainment, we quite often referred to the Department for Education. Now you can see on the right-hand side of this slide an overall search strategy that formulated our Gypsy Roma Traveller community health profile. So from that initial Ovid search, where it's outlined the PsycInfo, Embase, Medline and Web of Science resources, plus that snowballing and the additional data sources from those other healthcare databases, identified a total of 3,666 initial resources. Once we had gone through all of these resources and checked for viability, whether or not they were appropriate and whether or not they were relevant to the topics included in the profile, we ended up with a total of 350 resources included in this one profile. It's also important to take a step back and understand the importance of why we are completing this work and why we have created these community health profiles. As the main aim of this piece of work is to help address and reduce the health inequalities experienced in different communities, what happens without those data sets? So in summary, without this complete and reliable data on our communities, we have a limited understanding of the specific health and wellbeing needs of our communities in Birmingham, and therefore we have an insufficient ability to advocate for and introduce relevant services and interventions that are going to be needed in these communities. Now, when we have this knowledge of the data, we have this ongoing cycle of improvement. We understand our communities better, so we can utilise this data to inform resource allocation and hopefully provide better and more relevant services and interventions. Once the services are more relevant for the communities and more appropriate, you hopefully end up getting better uptake and engagement with these health services. Now, once these people are involved with the health services and are more willing to communicate, there's going to be better data collection and therefore inform that evidence cycle again and again. Like with any research, there are going to be some limitations of these community health profiles. Firstly, when we're looking at investigating the data of specific communities, most data sets look at aggregating communities into these broader groups, which makes it harder for us to actually understand the specific health needs. So for example, when we were looking into the data research for our Chinese community health profile, the Chinese ethnicity is reported differently across different data sets and often reported just under the other Asian or other ethnic group category instead of the Chinese ethnic group category, which makes data analysis quite difficult. Also, in a lot of these communities, there is a historic mistrust in healthcare services and a fear of discrimination. So people of various identities may not choose to disclose their identity in healthcare settings and healthcare data collections. And this results in incomplete and limited data sets. So the data that is presented in these community health profiles may not represent the entirety of a specific community group. Also, there's limited research on a local level, and often the profiles relied on national and even sometimes international data sets to fill the different sections of the reports. There are also specific limitations for each profiles, including the data collection methodology or the lack of available data, etc. And they're going to be identified in the specific profile methodology section. Now moving on to what we can actually expect to find within each community health profile. As we described earlier, the themes that are presented in the reports are taken from the health and wellbeing strategy, and they focus on a life course approach, starting at getting the best start in life and going all the way through to aging and dying well. They also look at those wider determinants such as the healthy and affordable food, physical activity, employment and housing, etc. Each of these topics is going to be subdivided into further themes. So for example, within Protect and Detect, we cover screening, vaccination, sexual health, COVID-19, respiratory infections, other infectious diseases specific to the community, and oral health. And we don't just look at the quantitative data. So where the data is available, we do report on prevalence and incidence rates or uptake of services and provisions. However, we also try and report on beliefs and attitudes, any community specific knowledge, the level of knowledge or education in a community relating to that topic, and any barriers or facilitators which come into place when accessing services relative to that topic. One of the most relevant data sources that was included in every one of the profiles is the census, and especially in the 2021 census, a lot of the communities we could extract data either using ethnic group, country of birth, sexual orientation or gender identity, and do a lot of multivariate analysis using their custom dataset tool. We looked at geography in terms of population estimates and distributions for population-based and locality-based approaches to health interventions. We could get a really good understanding of the different demographic characteristics such as the age, the country of birth, the migration status of a lot of our communities. There were some of those other characteristics that we could also summarise from the census, including someone's English proficiency, their main language, their national identity, or their faith and religious belief. And the census also told us a lot about those wider determinants of health, and we're able to extract information on highest level of qualification, occupation and economic activity, health, housing and disability, almost entirely at a local level, or for some communities in England and Wales level. Now, there were still also some limitations to using the census information. For that ethnicity multivariate data, it was only available for the top 20 ethnic groups, although the census does have one data set that outlines 288 different ethnic groups in Birmingham, so there is a little bit of a limitation in terms of how many of those 288 categories we can examine further than just raw population numbers. Also, if we looked at communities that were predominantly recent migrants, that country of birth data for that multivariate analysis, so combining country of birth with highest level of qualification, for example, is typically only available at England and Wales geography. An analysis of some of our LGBTQ+ communities was limited due to different variables being grouped together. For example, gay and lesbian did not have separate categories and were presented under the same grouping. So far, we have created 25 different community health profile reports spanning over 6 particular topic areas, including ethnic group or country of birth, regional communities for where multiple countries are included, such as Caribbean islands, communities with a disability, communities of different religion and faith, LGBTQ+ communities, and other communities, which typically looks at communities of experience. For each report, there is a full written report available, which are typically 100 to 150 pages long, and they've all been published in English, and the first batch of profiles, where relevant, have been translated into community languages. Now, as we understand that 150 pages is quite a lengthy report, we've also created the individual infographic summaries, which you can see on screen, which describe the main aspects of the health inequalities of a specific community in 1 to 4 pages to really make it easy to identify and summarise the findings of the profile. Each profile will also have an associated launch event where we will talk through the key inequalities and next steps for engagement from that profile report. Additionally, because we don't want these to just be reports, we do a lot of work with community organisations and partners as part of this programme, and any resources that they create as part of their projects with us can also be found on the website. Okay, so now we've looked at why we've produced these community health profile reports, what kind of information is included in each report, and what resources are available. So now we need to look at how we use these community health profiles and what are those next steps going forward. Now, this list on screen isn't a complete list and is just a summary of some of the suggestions of how we can use these profiles. So, for example, they can be a really good tool in building cultural intelligence. So, reading one of these community health profiles can help support in building your knowledge on one of these specific communities and maybe even help formulate a plan for delivering cultural awareness training in the future. You can use these profiles to inform your practice, so use this information in future strategies and future reports that will help inform relevant healthcare services. And also you can use it when talking on a primary level data or primary care, with a community, so providing relevant dietary advice, for example. We also want to make sure that the profiles are as high quality as they can be. So as part of our ongoing review process, we want to make sure we have an opportunity for two-way and ongoing communication between ourselves and either community individuals, community organisations or healthcare providers. And we're looking at including feedback from any of those different stakeholders within the profile reports going forward. There are some areas which may be included in potential feedback, including looking at, is the language appropriate and relevant to the community that the profile is describing? Is there an area of health which is important to the community which hasn't been discussed in the profile, and we can look at doing additional data and research to include that in future iterations of the report? Have we missed a key data set or relevant report that would be really useful to include in this profile to help increase everyone's understanding of the community's health needs? And is there any other general comments and feedback? Now, the easiest way to give feedback is by emailing our communities inbox at communitiesteam@birmingham.gov.uk, and further information on contacting us can be found in the description of this video. Now, finally, just to close, we want to talk about how we can use these profiles going forward. So let's say you've watched this webinar and you may have read one or multiple community health profiles. What happens next? So first and foremost, we suggest that you share these profiles with anyone you might find relevant. Is there anyone in your team or your wider organisation who might want to learn more about a specific community, or they are potentially looking at doing a project around a specific community? Do you work with any partner organisations or community organisations that work with these specific community groups that may find these profiles useful in terms of encouraging and influencing different healthcare services? Now, how else can we use these profiles in our day-to-day work? Again, just a short checklist, but this is not an exclusive list. Have you maybe referenced the profiles in a new project or report you've been working on? Have you included any of the findings of these profiles in project or service proposals? Have you brought along any of the findings from these community health profiles to discussions with relevant stakeholders that might influence decision making when it comes to healthcare? Have you used any of the findings from your profiles to make your daily practice more inclusive? Now, these are just a summary of some of the ways that we can use these profiles going forward. And I want to make it really clear before we finish today, these profiles should be a start point for developing services and interventions and building that cultural intelligence. Because of the breadth of information that's covered in each of these community health profiles, they typically can only offer headline data on each section. Therefore, you should always use other sources of information when looking at your evidence-based practice, including internal intelligence, community intelligence, and results from previous projects that you've completed to support future projects or interventions. Finish up today, and to stay in touch with any future communications or information around this programme, if you're interested, I've included a couple of the key contacts or key links for this programme work. All of these links and email addresses should be linked in the description below as well. First and foremost, we have our communities team inbox, which can be the main location for any questions, queries or conversations that you'd like to have around this profile work. We also have a mailing list where we keep our subscribers up to date with any new information that comes out around these profile programs, any opportunities for action, any engagement opportunities and any upcoming funding opportunities. We also have a homepage which sits on the Birmingham City Council website, which covers all of the profile reports, additional resources, and any resources from relevant community engagement partners. The Healthy Brum YouTube channel, where this has been uploaded to, also has a breadth of other videos describing the specific community health profiles, including launch events. I hope you found today useful. Thank you everyone for watching, and if you have any further questions, please leave them in the comments below or send us a message on our communities team inbox.